Why do you feel like psychedelic therapy, people seeking treatment for things like anxiety and depression, and the success you're seeing at Mindbloom, is there anything in your mind that makes it clear why we're seeing all of those things kind of converge now? Is there a cultural element? Is that kind of a medical element? Just talk about kind of the setup and why we're seeing this resurgence in just the last couple of years. And it seems like as we look forward, it's just going to continue to accelerate.
I think there's a confluence of factors. There's just the mental health epidemic that's becoming more and more clear. Something like over half of the population will have mental health indication in the course of their life. Something like 60% will never get treatment, most because of cost. So you have this problem that's becoming harder and harder to ignore. COVID has certainly brought that to the forefront even more so. And then you have this resurgence of research in psychedelics that institutions like Johns Hopkins have done such a great job of kind of paving the way to show in a really clinically sound manner, and MAPS as well, just that this isn't something that we think is true. This is something that we now have strong clinical data to show is true. There's also been great news coverage of psychedelics. There's the book How to Change Your Mind by Michael Pollan that so many people cite as kind of their education on the history and current state of psychedelics and their like true medical potential. So I think you have all of these different factors that are helping to reduce the stigma and lead people to want to try these as legitimate mental health treatments. And you even have institutions like the FDA that are giving breakthrough or fast track designations. So they're saying, we want to make it easier to move these through the clinical trial process as fast as we can to get them FDA approved because they show such promise clinically. And they've given these designations to psilocybin, MDMA, and ketamine.